My name is Danielle Bollinger. I am 48 years old. I'm married to my husband, Parker. We've been married for 20 years, and I have two beautiful girls. We have no cancer in my family, none whatsoever. So when this kind of came about, very eye-opening, very shocked. Didn't think it would ever happen. I get a phone call, and it was from a nurse from Arrington telling me that I have breast cancer. I was diagnosed actually January 2nd of this year with invasive carcinoma breast cancer. Mine was considered a stage 2, but it was a grade 1. The word cancer. Sorry. The first thing I think is I'm leaving my family. I'm going to be leaving my family, and I feel that this is something that I'm going to have to go through for the rest of my life. And will I live or die? It's a scary word. I knew of Covenant because I preferred going to Covenant. I felt really comfortable coming into Arrington. I know I have my choices to where I get my care, but I do believe that this was the best place for me. I found my strength probably, of course, with my healthcare providers for sure. The nurses, the doctors. I felt loved at that time, and I felt like I had no worries. Finding out that I did have to have chemo, I was terrified of losing my hair. That's my identity. I feel like somebody educated me on the cooling cap.
Well, the science behind it is pretty simple. You lower the temperature of the scalp, so you minimize the blood flow to the hair follicles, and you minimize hair loss. The self-image is important, and hair loss also is, we kind of don't emphasize on it, but it has really important meaning for each woman. We want to preserve their hair as much as we can, and this cool cap, I think, is a very good tool to help us doing that.
It was something that was a must and a need for me, because if I did lose my hair, at least I tried. But I will tell you, if I didn't have the nurses up there in the Arrington chemo department pushing that thing on my head and just getting it going, I don't know if I would have continued it, you know. In my opinion, I believe that the cooling cap is like something every cancer patient needs. Keeping your hair, especially for each individual person, is something that we have to live with, you know, and it's hard if you don't have your hair. I've had wonderful outcome with my diagnosis. I am considered, I guess you could say, cancer-free right now. I've gone through chemo, I've gone through radiation. And if I were to say, or if I were to come up to you and not know you and have a conversation with you, I don't think you would know that I had cancer at all because of the cooling cap.